Hi, I'm Alice Benjamin, clinical nurse specialist, family nurse practitioner, and chief nursing consultant at nurse.com for Relias.
Hi, I'm Jessica Brumley, certified nurse midwife, current president of the American College of Nurse Midwives, and associate professor in the Department of OBGYN at the University of South Florida.
Okay, now, Jessica, thank you so much for your time, sharing your expertise with us today. Again, can you share with us some of your perspectives on our recent Relias report? We have a maternal mortality and morbidity prevention report. This was a 1-year-long project by Relias where we surveyed clinicians and providers across the U.S. who work with perinatal patients about their organization practices relating to maternal health. So what are some of your thoughts on our findings?
Sure. Thank you. Thank you so much for having me. I appreciate this opportunity. What I really appreciated about the report is that very sort of systems orientation that this took to the issue of maternal mortality. A lot of work is being done in the space of what can healthcare systems do in order to improve outcomes for pregnant people. And this report looked at the individual's experiences with what their systems are doing, which really gives insight into what we can do better. The information is out there, but is it being activated? Is it being implemented? Is it getting down to the level of the individual clinicians? And what this report says is that there's work to be done.
In the report, we presented 5 main findings. We talked about overall awareness and attention, clinical risks, behavioral risks, social risks, and maternal health education. Which findings did you find most noteworthy and why?
What I think was most impressive is the work around the sort of policies, protocols, and education that folks are not, seeing being implemented or not aware of, and because those are really some of the, I don't want to say simple, but sort of foundational, right? So it's the foundational work that organizations need to do. It's that quality improvement kind of approach to this work. And there's so many great resources that are available to help to make this work happen. And big organizations, right? The Alliance for Innovation in Maternal Health and the American College of Nurse Midwives, the American College of OBGYNs, we've done a lot of work in spreading the information out there to organizations, and still there's much work to be done.
So in our findings about social maternal risks, we asked about risk reduction related to social determinants of health, including racism and implicit bias. And nearly 1/5 of survey participants did not perceive racism and implicit bias as maternal health risks. Now, this is interesting because we do know that there's current research that points to social risks as a main contributor to maternal health disparities in the U.S. What are your thoughts on that?
It didn't surprise me. Does it upset me? Is it sad? Absolutely. I've spent my entire career looking at factors such as experiences of discrimination and racism. And this is very clear in the science that that these experiences are not only happening but impacting health outcomes, and we have really solid research to support that notion. But what are we doing with that information, right? I mean, we're asking the questions. Maybe are we asking them in a way where folks feel safe to be able to answer honestly? That's work that I believe needs to be done. And then what are the resources that are available, and what's happening in our communities that can help to address these social determinants of health? There's still a lot of work that needs to be done in that space.
Yes, there is. And that's, you made a good point about having resources. We also, in the report, we asked about screening and follow-up of a range of social risk factors, including cultural competence and implicit bias training, standardized patient assessments, using evidence-based tools, and education for both the providers and the patients, and several others. So, what are some of the social support needs for patients that you find are most important to mitigate social risk factors?
There's so many. What we are seeing when we're screening for social determinants of health is one, that there's a lot of housing insecurity and food insecurity. But for pregnant and postpartum people, what we know is that the postpartum period is a time where people need support. They need to feel a community that's wrapped around them, and that when that support is provided, that there's lower incidence of postpartum depression and anxiety. It's the beginning of a family, and people have so many pressures that they're experiencing, and until we as a culture value that time, we're not going to see an improvement in that experience, right? People are going back to work soon. They're far from their family often, right? We're not like surrounded in community with people who we're really close to as frequently as we were, in the past. And so those are really strains on a new family. And so what can we do in order to help to connect people with resources in the community, but not just agencies, right? Like they need to feel loved and nurtured and surrounded by people who are caring for them. It's big. It's bigger than only providing, like, sort of government agency kind of referrals.
I agree. I definitely think that's something that I wish we had more of. Um, and along the lines of, other resources, especially those specific to the social risk factors, like advocacy and support, which you mentioned, especially for those who've experienced violence, assistance for those with financial needs. You also mentioned housing earlier, linguistic and cultural support, telehealth for rural areas, and others. And now, obviously, this is your world. This is the work that you do. These are the patients you've cared for. We found that only 25% of survey participants indicated that doula or midwife support is a need they address at their organization. So, in your opinion, what does that mean for perinatal patients?
There is long-standing evidence that finds that when people are cared for by midwives, that they have better health outcomes, and that in states where midwives are more well integrated into the healthcare system, that those states have better maternal health outcomes. And there's also evidence that shows that people who receive continuous labor support by a doula have a decreased incidence of cesarean section, right, and improved experiences. And so we have really solid evidence that shows that this is a model of care that improves outcomes. But what I see happening in healthcare right now is a move towards really large systems that are compartmentalized, that people, work is happening in silos, and it's happening outside of the community, right? Mm-hmm. Historically, midwifery care was community-based care, right? You cared for people in their homes or near their homes. Midwives were a part of the community, right? Doulas are like a trusted family member. Midwives are like a trusted family member. That's how you feel love and support and community, right? That's how you build that, is by having that sort of continuity of care. It's by having that trusted person who you can lean on when you need to make difficult decisions. And so we really need to have systems that implement these evidence-based strategies. I'm starting to see presentations at annual meetings for large organizations that are talking about how they integrated midwives or doulas into their healthcare system. We're starting to see Medicaid plans that are covering midwives and covering doula services. It's a beginning, and some states are further along than others for certain. But what we know is that reimbursement for our services in general is at a much lower rate than what is for physician care, and birth center care is reimbursed in most states at a much lower rate than hospital care. And so it makes it really hard to sustain that model if it's not reimbursed equitably. But we know that this is what the evidence supports. So there is quite a bit of advocacy that is being done by many organizations in order to help to raise awareness on the need for expansion of this model.
I agree. Now, considering your work spans midwifery, obstetrics, and gynecology, where do you see patients at most risk for falling through the cracks? And what should healthcare providers be focusing on to bridge those gaps?
There's so many reasons why people don't access care in the sort of recommended way. There are individuals who don't see value in the way in which care is being provided. They, right, in sort of in this very sometimes impersonal way that care can be provided in the current system. Those people with the most resources will advocate for themselves. They'll have a voice and they'll make sure that, they're cared for. Our most vulnerable populations, those individuals who don't understand the healthcare system, who are afraid of the healthcare system, are less likely to either access care, be able to get into care in a timely fashion, or even want to. And so we really need to figure out, how do we reach those people that are not accessing care? What is it that we can do differently? What kind of relationships can we form? What kind of community partnerships can we lean on in order to meet the people where they're at? I think is really critical.
I see what you're saying. It's important that we meet people where they are, whatever that looks like. I think we're in a place where we can be creative, especially with all the things we've gone through with COVID and technology. I think the opportunities are endless. How can OB care providers improve preventative maternal care?
Well, I think that there's, number one, issues with insurance coverage, right? And people accessing care because of lack of insurance. People need to have access to care. In states where Medicaid was expanded or extended, outcomes have improved. And so people need access to healthcare. We come into pregnancy healthier when we have had access to healthcare, before pregnancy. And then as far as during pregnancy, we can improve health outcomes by improving the system of care, right? And so some of what I talked about before around the kinds of care providers, right? Having an interdisciplinary team, and also having some standardized protocols that we follow in managing things like anemia in pregnancy, right? If you're adequately managing someone's anemia, then they go into labor and birth better able to manage a hemorrhage if it occurs. If a hemorrhage occurs, we need standardized protocols on how we manage it.
Now, Jessica, I'm going to go ahead and say this, because some people will watch this interview and when I ask the question, what can providers do to improve preventative maternal care? I think the initial thought is, what can I do at my place of employment? What can I do within the confinement of my clinic or my hospital? And, I believe the role of the healthcare provider has expanded beyond that. As you mentioned, advocating for different policies and insurance issues and housing issues and things beyond our four walls that we're in. What would be your message to healthcare providers when asked to, dare I say, do something more, do something different than what we've been doing? How can we motivate people to step up? And you're the president of ACNM. You're leading the charge. You're advocating. You're doing things outside of your direct patient care role. That's because you're really advocating for patients, for people, so that you can actually be able to do a better job when you're actually in your clinic, and so people have a better experience, have better health outcomes.
Yeah, coming to work, that will fill your cup a little bit, but it will start to drain it we work in a system that's really complex. And if you want to sustain your career, then having a community of people that are like-minded will help you to really have longevity and to feel like you're making an impact at a higher level. That's what my professional organization has done for me. Right? It is my professional home, and it's where I've had an opportunity to build relationships, be inspired, build my skills, and to advocate for change at a higher level in partnership with others, right? Because we can do so much more together. So whether it's showing up to a representative's office, right, with a local colleague to talk about legislative change that I think needs to happen in my city or my state or at the federal level, I can do that so much easier when it's in partnership with other midwives for me that are part of my professional organization. So I believe that every healthcare professional should be engaged with their professional organization, where they will find community and partnership and an opportunity to advocate for the change that they want to see in the world. Currently, I partner with my state perinatal quality collaborative on what we've called the Mother Focused Care Initiative, and this is a version of birth equity work that's happening in many states. And the sort of angles that we've taken, or some of the primary aims that we've been working on, include training on respectful maternity care. That could be expanded to include topics such as implicit bias, and we cover topics such as cultural competency and humility. We also have been working on screening for social determinants of health and making those kind of warm connections to the community, and then partnering with patients, right, with the people that we're looking to care for, and centering their voices by doing work to survey patients after they've had a birth experience, and looking to see what were their experiences of respect in their hospital, and including them on our teams as we do this work. I think of this work as really foundational to all the other work that we want to do. Many of the patient safety bundles focus on a diagnosis, improving hemorrhage, improving the treatment of hypertensive emergencies, right? But all of that can be improved upon if we improve on the patient experience, if we improve on the way in which care is provided, if we make people feel safe in our care. And it's really foundational work, and so I'm really proud of having been part of that team, and look forward to seeing how that kind of work can be built upon in the future work that we do.
Okay. Thank you so much, Jessica, for your time. I appreciate that. Good interview.
Always a pleasure, Alice.
Great stuff.
Have a great day.
Thanks. Bye-bye.